Kids Health Watch with Dr. Sang is sponsored by Sang Pediatrics.
Well, every month we focus on children's health with local pediatrician Dr. Nu Sang from Sang Pediatrics in Fresno. Dr. Sang, thanks for being here.
Thanks for having me, Kim.
We are talking once again about a topic that is near and dear to my family,
Okay.
so I am filled with questions.
Okay.
We're talking about eczema.
Yeah.
Now,
Yeah.
what is it for those who may not be familiar with it?
Right. So eczema is super common, and it's something that nobody ever talks about, but it affects a lot of people. So I'm really happy to go on to the program and talk about it. It is a skin condition that dries out, makes it really itchy, and it can break the skin. So that's why I wanted to talk about it. It afflicts a lot of people and causes a lot of discomfort and sometimes decreased quality of living.
Yeah, well, physical discomfort and psychological discomfort.
Yeah.
You could really be embarrassed by it. So,
Yeah, right.
First off, is it pretty common?
Well, yeah, it's really common because 1 in 10 children can have it, and you can get it at any time in your whole lifetime. And some people outgrow it by 4 years old, but there's a segment of population that will extend into adulthood, or some adults can get it too. So this affects a lot of people in the population.
Yeah, like somebody in my family, not until he turned 60.
Right. So you can get it at any time. And it really is caused by just a decrease in a certain protein on your skin that keeps bacteria out and keeps water in.
So can we get a lotion that puts all that protein on our body so it doesn't happen?
Not the protein, but the moisture. So that's the whole thing, is that you want to be able to moisturize the skin. And so that's what kind of keeps the eczema away, is just keeping the moisture in.
Okay, so it doesn't mean that you're allergic to something specific, does it?
It doesn't mean that you're allergic to something, but I will tell you, certain patients with eczema will have increased allergies. So they'll have seasonal allergies, they may have asthma, they may have food allergies, but the food doesn't cause the eczema. Okay, so it's not that.
Wow, I keep looking for something for you to say, oh,
Yeah,
we're
I
going to
can't.
do that or not do that, and so far, okay.
Yeah, I can't do that.
Is it contagious? We have a family member who says,
Right.
you want to hold hands, but if you have it all over your hands,
Right.
can the other person get it?
It's not contagious. However, I will say that, like I said, it's a decrease in the barrier of the skin because you're itching it so much, and you're actually breaking the skin when you do that. When you do that, it can get infected, and you can get some staph infection on the skin, and then you transfer that to somebody else who also has a breakage of the skin.
Oh my.
Yeah, so that's different. And we can go over that in a different topic.
Oh my
but
gosh,
people with
okay.
eczema have more skin infections. It makes sense, right? Because there's decreased barrier of the skin.
Okay, is it
Yeah.
more common summer, winter?
Summer and winter, it just depends on what you're doing in the summer and winter. Are you moisturizing skin? We live in a dry climate in the summertime, so it's actually more dry. It makes it more itchy. So it just depends on where you live.
And what about the body? Can it happen absolutely anywhere?
Yeah, it can. But in babies, it's more common on the face. So it's on the cheeks or around the mouth. In adults, it's actually more common in flexor surfaces like elbows, wrists, knees, and ankles. And it makes sense because we're always flexing our muscles or moving it, and skin is rubbing against each other and can cause a little bit irritation.
Okay, there are tons of lotions out there.
Yeah.
Sometimes lotion isn't enough. Got a
Right.
family member who had to get a cream
Right.
prescribed by the doctor.
Right.
So what do we do?
Okay, so moisturizing soaps and lotions now, because certain soaps will dry out the skin, so you want to avoid that. So certain moisturizing soaps actually help, lotions help, creams help, all that. The doctors usually prescribe steroids as the first line against eczema, and it helps temporarily. But eczema is a chronic condition, so it's going to keep coming back, so you don't want to use it too often. You just want to use it for flare-ups. There are also non-steroidal creams and lotions that can be prescribed. They're newer, and they're more expensive. But at the same time, we can prescribe those and give it a shot because, again, quality of life can be affected, and that's priceless, right? You can't sleep when you're itching.
Right.
Yeah.
And how do you hit a good golf shot when you got it all over your hands?
Right, exactly.
For example, that's not for you.
But you do want to moisturize as often, and we're washing our hands all the time, so of course it's going to flare it up.
Good point.
Please moisturize, and you'll live better.
Okay, thank you.
Yeah,
Dr.
sure.
Sang, really appreciate it.
Sure thing, Kim.
This is Dr. Nu Sang of Sang Pediatrics. And if you would like to watch the segment again or maybe find more information on how to contact Dr. Sang at one of the 2 Sang Pediatrics locations in Fresno, or see any of the other interviews we've done that have really been fascinating and eye-opening on helping our families, log on to kmph.com. Click the tab labeled Kids Health Watch with Dr. Sang.